So a female patient was started on lithium therapy for bipolar disorder for 6 months. She kept the fast for few days due to religious reasons and presented with seizures, cold tremors, confusion, and weakness of limbs. So, which of the following investigations should be done to help diagnose her condition? A is serum electrolytes, B is serum lithium levels, C is ECG, and D is MRI. So, this is one of the scenarios that was given in NEET 2020. What should be your suggestion on a person like this who has stopped lithium in fasting? Okay. So the answer should be when we are suspecting signs of lithium toxicity, okay, which are the seizures, cold tremors, confusion, and weakness of limbs. So the answer should be always check for serum lithium levels. Okay. Now, why is this happening? That is a very good question. Okay. So the answer lies in this case. The kidney cannot actually tell apart between which is what, which is sodium, which is lithium. Okay, because when someone is fasting or having dehydration, there is decreased intake with sodium, and the kidney panics and it now aggressively reabsorbs sodium into the proximal tubule to save it. Okay, because it needs sodium. Now, because lithium is handled almost identically to sodium, the kidney accidentally hoards and concentrates the lithium too, which precipitates the toxicity. So it was supposed to take in only sodium, but because our kidney is confused, it also takes in lithium out of the confusion. Okay, because sodium and lithium are identical, which leads to the toxicity in this case. Okay, so whenever a patient is on lithium, we would always warn them whenever they are undergoing some dehydration, say suppose diarrhea, vomiting, or in this case, not eating for a while, they should be very careful and skip with the lithium doses if they are having these kinds of toxicity effects, and they must return to us immediately so that we can also address, or if they are already having toxicity symptoms like in this case, they must immediately go to a general hospital to get adequate hydration. Okay, so this is what is also written, you can see over here. So toxicity here manifesting as seizures, post tremors, confusion, and limb. Okay, so this picture is also consistently with severe, that is greater than 2, as we have discussed. Greater than 1.5 is often the threshold for producing toxicity in lithium, but in case it's very prominent, so most likely the serum lithium level might be 2 or greater than 2. Okay, so we will go with serum lithium estimation. In this case, it will be life threatening. So we will be able to save a life by measuring the serum lithium levels. Okay. And the other things, electrolytes and ECG are reasonable supporting investigations, of course. Okay. But if we have to choose one thing, we will go with serum lithium. Hope you have learned something from this. We will meet in the next section.